I think it's critical that we really train dietitians in Romania because the health problems are getting bigger and bigger in Romania. For example, the incidence of heart disease, hypertension, diabetes, obesity are rising as well. So I think there's going to be, dietitians can play a key role in helping the Romanians to really prevent some of these problems in the future, which actually ultimately will keep the healthcare costs down if we can prevent this disease and really give them the knowledge and the tools they need to make better decisions when they're at the supermarket, cooking at home, feeding their families, their children, their grandparents. And it's not about taking away the food that they love. It's about how to maybe make it a little bit healthier, how to use a few ingredients less, a little less salt, a little less fat, a little less sugar, boosting the flavors with herbs and onions and garlic and spices that don't have calories. I think it's extremely important to have dietitians in healthcare and community centers because the physician, the nurses cannot do all the work. And dietitians are the experts in nutrition. What the physician, we work as a team. The physician has a role to diagnose the patient, to provide the treatments the patient needs, and then to assign the people that are going to help them get that patient better. And for example, a dietitian can provide great tools for a patient to learn how to cook healthier at home, to develop new recipes, to know how to shop wisely, to know how to shop with the little money that they have. So the dietitians can spend a little more time really getting the patient excited and motivated to follow a diet that will ultimately help that patient to get better. But it's a teamwork, and I think that's what we need to understand, that dietitians are not going to take away time and money or expertise from a physician or a nurse or other healthcare providers. We work as a team so that we ultimately can help that patient get better and go home and live a fulfilling life. Well, in the United States, I've been doing nutrition for over 30 years. So I have worked in community centers, governmental feeding programs. I worked also teaching at universities. I've also done research. And most lately, I work in consulting. So I consult with big companies that are food industry companies to really help them to make products that are healthier for the public, to really bring messages that really resonate with the different cultures, that we have a blending pot in the United States. So how to really create messages that will really apply to the different cultures that we have in the United States. Because not everything is the same for everybody, especially when it comes to nutrition. Nutrition is very, very individual. What works for you might not work for me. So in my work, I try to work with the different cultures to provide them the knowledge that they need for that particular population. So it's kind of exciting to work in that, and trying to make sure that the communities get the right information.
If I were a patient and I come to you, how will you approach me?
Well, first of all, I want to learn about you. I want to learn, where you're from, how you cook at home, what you eat, what you love to eat, what you don't like to eat. I want to learn your family, your history, your medical history. I want to learn about, your education, how active you are, what's your activity level, and all these things first, more than anything. And then sit with you and really create a plan together. Create a plan for what you need, what you're looking for. You want to lose weight, you want to have better skin, you want to have better hair, you want to have better energy, you want to play sports, run a marathon, all these things, what you want to do, then I can help you then create a plan for that journey that you want to take.